Hey guys, my name is Kim McGee and I'm a nurse practitioner student at Auburn University, and I would like to give a presentation on sodium glucose cotransporter 2 inhibitor. Okay, this is basically anti-diabetic drugs, and all the drugs are listed on here that falls under that category, and mainly we're going to talk about a drug named Invokana. And the action of this drug, it inhibits the sodium glucose cotransporter 2, which reabsorb the glucose filter by the kidneys, increasing the amount of urinary glucose that is excreted. Okay, I have a patient here, Miss Carter, and I'm going to be educating her about Invokana. If you have any questions, just stop me and ask me for anything. Okay. All right, the therapeutic drug of this Invokana is, it can be used alone or used with other combination with other anti-diabetic drugs such as metformin to reduce blood glucose in adults with type 2 diabetes, along with the exercise and diet. Okay, Invokana is used with the diet and exercise to improve glycemic control in adults with type 2 diabetes, and also to reduce the major adverse cardiovascular events, and also to reduce the risk of end-stage renal disease in adults to reduce the death and hospitalization with heart failure in adults with type 2 diabetes. Okay, pharmacokinetic of the Invokana absorption is, it has an oral bioavailability of Invokana is approximately 65%. It can be taken with or without food. Distribution is mainly extensively bound to protein in plasma and mainly to albumin, and excreted in the urine and feces. Okay, mainly the pharmacotherapeutic of the Invokana is to mainly report any kind of risk for lower limb amputation. So if a patient has a sore or any kind of tenderness or new pain on their toes or on their foot, to report immediately and stop the medication. And contraindication is patients that are with a severe hypersensitivity reaction to this drug, an individual with a severe renal impairment and a GFR of below 30 ml per minute, and those with end-stage renal disease, and the patient on dialysis. Okay, adverse drug reaction of Invokana, it can decrease the digoxin levels. So if you are on digoxin medication, you need to monitor that frequently. Also with patients that are taking the drugs, phenytonin or other drugs, it can increase the plasma level, and therefore monitoring is required for these drugs. Okay, indication and clinical use of the Invokana is to use it with diet and exercise to improve the glycemic control in adults with type 2 diabetes. Invokana is not for patients with type 1 diabetes and not for people with diabetic ketoacidosis. Okay, rational drug selection will be this drug. It can reduce the blood glucose level, and it has lower blood glucose level more significantly than any kind of DPP-4 inhibitors in clinical trials. Invokana has shown to help lower the blood pressure level as well. Okay, we need to monitor the electrolytes such as potassium and magnesium, and it can also increase the lipid level, so to assess the LDL cholesterol level more frequently. All right, patient education: taking PO, give before the first meal of the day, to store the tablet at the room temperature. Available forms are 100 milligram and 300. Okay, lifestyle management: patient need to do a general diabetic care, and including diet and exercise, and monitor blood glucose level and A1C level, and signs of to manage the hypo and hyperglycemia. Okay, the main takeaway of this drug is not used for people with type 1 diabetes, patient with low kidney function, so to report any signs and symptoms of acute kidney injury and decreased urine output, patients that are taking strong diuretic medication to maintain an adequate fluid intake, to report signs and symptoms of hypotension, monitor patients for any kind of infection, new pain, tenderness, or sores or ulcer on their lower limbs. It can increase your digoxin levels, so to monitor the digoxin level more frequently, and watch for signs and symptoms of diabetic ketoacidosis. Thank you guys for watching. If you have any questions, just leave a comment.